Welcome to our deep dive, all about ICD-10-CM coding, specifically for chronic kidney disease.
Okay.
We're going to decode these guidelines,
Right.
explore the tricky situations that can pop up,
Yeah.
and hopefully equip you with the knowledge to navigate this whole complex area with confidence.
Absolutely.
We've even linked the MCG manual in the description. That's the Absolute Medical Coding Institute's Medical Coding Guidelines Manual, just to help you along.
That's right. Understanding these codes is vital not just for billing, but for ensuring patients receive the most appropriate care.
Yes.
And for maintaining the integrity of the data used in research and public health initiatives.
Okay, so let's jump right in.
Sure.
One of the first things that struck me is the CKD staging system.
Yeah.
I know it's crucial. Can you break down why it's so important for coders to get this right?
Absolutely. Think of it as a roadmap for understanding how CKD progresses.
Okay.
Each stage reflects a different level of kidney function impairment, which in turn guides treatment decisions and helps predict the course of the disease.
Okay.
For instance, someone in stage 2 CKD, coded as N18.2, has mildly reduced kidney function, while someone with a code of N18.6, indicating end-stage renal disease or ESRD, will require dialysis or a transplant.
That makes sense.
Yeah.
So the codes actually tell a story about the severity of the disease.
Precisely. And it gets even more intricate when you consider that each stage can have more specific subcodes to capture the nuances of an individual's condition.
I also came across these terms flip and tap in the MCG manual.
Right.
They sound more like dance moves than coding techniques.
Yeah.
Can you shed some light on what they actually mean and how they can be helpful?
I admit they do sound a bit more exciting than they are.
Yeah.
In essence, these are just tools to help you navigate the ICD-10-CM guidelines more effectively.
Okay.
The flip method, found within the MCG manual, provides a simplified version of the official guidelines, acting as a sort of cheat sheet.
Okay.
Tap, on the other hand,
Yeah.
is all about personalizing those official guidelines.
So it's about finding a system that works best for you.
Exactly. Let's say you're coding a case, and you need to quickly reference a specific guideline using the tap method.
Yeah.
You would first tab the relevant page in your ICD-10-CM manual, then annotate the specific guideline you need, and finally place the word tap next to the corresponding code in the tabular list.
Got it.
It's a way of creating your own personalized roadmap through the coding maze.
It sounds like having those little reminders strategically placed could save a lot of time and frustration.
Absolutely. And in the world of medical coding, efficiency and accuracy go hand in hand.
Now, another question that popped in my head is, what happens when someone has had a kidney transplant?
Okay.
Can they still have CKD? It seems counterintuitive.
It's a great question and one that often causes confusion. While a transplant can significantly improve kidney function, it doesn't always fully restore it to normal. So yes, it is possible to have CKD even after a transplant.
So how would you code for someone in that situation? Would you still use an N18 code?
You would indeed. You'd assign the appropriate N18 code based on their current stage of CKD. But you'd also need to add Z94.0, which signifies kidney transplant status.
So that additional code provides crucial context for their overall health picture.
Exactly. It alerts everyone involved that the patient has a transplant history, which can significantly influence their care going forward.
This makes me think about the importance of clear communication between coders and doctors. What happens if the doctor's documentation isn't clear about whether the patient's symptoms are related to the transplant or just the CKD?
That's where the concept of querying the doctor comes in. If you encounter documentation that's ambiguous or doesn't provide enough detail to support specific code, it's crucial to query the doctor for clarification.
So it's not about challenging the doctor's expertise, but rather ensuring that the documentation accurately reflects the patient's condition.
You've got it. Clear communication is paramount in ensuring coding accuracy, which in turn has a direct impact on patient care and the reliability of medical data.
Now, we've discussed how vital it is to accurately capture CKD staging, but what are some of the challenges coders might encounter when determining the correct stage, and how do those challenges affect patient care?
That's a really good question. One of the biggest hurdles is that CKD often presents alongside other chronic conditions like diabetes and hypertension. These conditions can accelerate the progression of CKD, making it tricky to pinpoint the exact stage based on lab results or clinical documentation alone. And this is where those detailed ICD-10-CM guidelines become essential. They provide specific instructions for coding CKD with comorbidities, taking into account the interplay between these conditions and their combined impact on the patient's health.
So it's about painting a complete picture of the patient's health, not just listing isolated conditions.
Exactly. For instance, Section IC.9 of the guidelines specifically addresses hypertensive chronic kidney disease, outlining the proper sequencing of codes to capture both the CKD and the hypertension.
Right.
Similarly, Section IC-19 provides guidance on coding CKD with transplant complications, recognizing the unique challenges associated with post-transplant care.
It sounds like these guidelines are a coder's secret weapon for navigating the complexities of CKD.
They really are. Think of them as a roadmap that guides you through the intricate network of codes, ensuring that you arrive at the most accurate and specific representation of the patient's condition.
Speaking of roadmaps, we talked earlier about those flip and tap methods for simplifying the ICD-10-CM guidelines.
Right.
Can you walk us through a real-life scenario where these methods could be helpful?
Absolutely. Imagine you're coding a case where a patient with stage 3 CKD also has diabetes and hypertension. You quickly reference the FLIP method in the MCG manual to get a simplified overview of the guidelines for coding CKD with comorbidities. Then you use the TAP method to mark the specific guidelines related to hypertensive chronic kidney disease with diabetes. By tabbing the page, annotating the guideline, and placing a TAP note next to the relevant codes in the tabular list, you create a personalized trail of breadcrumbs to guide you through the coding process.
It sounds like a smart way to stay organized and ensure you're not missing any crucial details.
It is. And remember, efficiency and accuracy are paramount in medical coding. These methods help coders streamline their workflow while maintaining the highest level of precision, ultimately benefiting both patients and the healthcare system as a whole.
Now, I can't help but think about how crucial it is for coders to have a solid understanding, not just of the codes themselves, but also the underlying medical conditions. It's not just about matching symptoms to codes. It's about understanding the bigger picture of the patient's health.
You hit the nail on the head. A skilled coder isn't just a code matching machine. They're a medical detective piecing together clues from clinical documentation lab results and physician notes to paint a complete and accurate picture of the patient's journey.
That's such a great analogy. And it highlights the importance of ongoing education for coders.
Absolutely.
The medical field is constantly evolving, so staying up to date with the latest coding guidelines and clinical advancements is essential.
Absolutely. Lifelong learning is crucial in this profession. It's not just about keeping your skills sharp. It's about embracing the ever-changing landscape of healthcare and ensuring that you're equipped to meet the challenges of tomorrow.
So for anyone listening who might be feeling overwhelmed by the complexity of ICD-10-CM coding, what advice would you give them?
Don't be discouraged. It's a challenging field, but it's also incredibly rewarding. Start by building a strong foundation in medical terminology and anatomy. Familiarize yourself with the ICD-10-CM structure and coding conventions. And most importantly, never stop learning.
That's excellent advice. Embrace those challenges. Seek out resources, and never underestimate the power of asking questions.
You got it. Remember, coding is a collaborative process. Don't hesitate to reach out to your colleagues, mentors, or professional organizations for support and guidance.
And I imagine having a mentor or being part of a professional organization can be particularly helpful when it comes to navigating those tricky situations where the documentation isn't clear or you're unsure about which code to use.
Absolutely. Having a network of experienced professionals to bounce ideas off of and learn from is invaluable.
We've talked a lot about the technical aspects of CKD coding, but I want to circle back to something you mentioned earlier, the impact of accurate coding on patient care. Can you elaborate on why this is so crucial?
Of course. Accurate coding isn't just about paperwork. It's about ensuring that patients receive the appropriate care and that their medical records accurately reflect their health status. Imagine a scenario where a patient's CKD stage is incorrectly coded. This could lead to delays in treatment, inappropriate medication prescriptions, and even missed opportunities for early intervention.
It's a stark reminder that these codes, while seemingly abstract, have a real-world impact on people's lives.
They absolutely do. And it's not just about individual patients.
Right.
Accurate coding also plays a vital role in public health initiatives, research, and resource allocation.
Okay.
When data is accurately coded, it becomes a powerful tool for understanding disease trends, identifying at-risk populations, and developing effective prevention and treatment strategies.
Like each code is a piece of giant puzzle.
Yeah.
And when those pieces are correctly placed, they reveal a comprehensive picture of the population's health.
Precisely. And that picture is essential for informing healthcare policy, driving medical advancements, and ultimately improving the health and well-being of communities worldwide.
It's inspiring to think about how something as seemingly technical as medical coding can have such a profound impact on the world around us.
Absolutely.
It's a testament to the dedication and expertise of coders everywhere.
Absolutely. Coders are the unsung heroes of the healthcare system, working diligently behind the scenes to ensure that data is accurate, reliable, and readily available to inform clinical decisions, drive research, and shape public health policies.
I think we've covered a lot of ground today.
Yeah.
From the intricacies of the CKD staging system to the importance of provider queries and the far-reaching impact of accurate coding on patient care and public health. It feels like we've only just scratched the surface of this complex, yet fascinating world.
Absolutely.
Before we wrap up,
Sure.
Is there anything else you think is important for our listener to know about coding CKD? Or really any medical condition?
One thing that often gets overlooked is the importance of staying current with coding updates and revisions. The ICD-10-CM system is a living document constantly evolving to reflect advancements in medical knowledge and changes in healthcare practices.
So coders need to be lifelong learners, always on top of the latest changes.
Precisely. It's not enough to simply memorize codes. You need to understand the rationale behind them, the clinical nuances they represent, and how they fit into the ever-changing landscape of healthcare.
That makes sense. And where can coders go to stay updated on those changes? Are there specific resources you recommend?
Absolutely. The American Health Information Management Association, or AHIMA, is an excellent resource for coders. They offer a wealth of educational materials, certifications, and networking opportunities to help you stay abreast of the latest coding guidelines and industry best practices.
It sounds like a valuable resource for anyone involved in medical coding.
It is. They also have a code of ethics that guides coders in maintaining the highest standards of professional conduct and ensuring the accuracy and integrity of health information.
That's reassuring to know.
Yeah.
Especially in a field where accuracy can have such a significant impact on patient care and research.
Absolutely. It's a huge responsibility and one that coders take very seriously.
Well, I think we've given our listener a lot to think about today.
Yeah.
Any final words of wisdom before we sign off?
I would say embrace the challenges, stay curious, and never stop learning. The world of medical coding is complex and constantly evolving, but it's also incredibly rewarding. Knowing that your work contributes to better patient care, groundbreaking research, and improved public health outcomes is a powerful motivator.
Couldn't have said it better myself.
Yeah.
So to recap for our listener, accurate CKD coding is about more than just getting the numbers right. It's about understanding the nuances of the disease. The importance of clear documentation and the profound impact these codes have on patient care research and public health.
And don't forget about those helpful resources like the MCG manual linked in the description and professional organizations like AHIMA. They can provide valuable support and guidance on your coding journey.
This has been a truly insightful deep dive. We hope you've enjoyed this exploration of ICD-10-CM coding for chronic kidney disease. Stay curious, keep learning, and remember, even medical coding can be surprisingly fascinating.